Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, cost. Interpretation of new enhanced barrier precautions worry providers as rule kicks in. A new set of regulations requiring the use of EVPs for many nursing home residents has left providers scrambling to understand the rationale behind some standards and grappling with the potential cost. Providers from several facilities pressed officials from CMS about how to interpret the new rules, especially since surveyor guidance for regs hasn't yet been published. The use of EVPs for residents who carry or are infected with MDROs, those with chronic wounds or indwelling devices, went into effect last Monday. CMS officials described the adoption of the gown and glove guidance established by the CDC as an effort to align with nationally accepted standards. Nursing home representatives on the hour-long call inundated officials with concerns about possible discrepancies and how to interpret some of the rules and intricacies, including the flexibilities. Some questioned why they allow for non-gowned and glove transfers of some residents in common areas such as dining rooms, but not in others. Different standards are counterintuitive and raising concerns among many nursing home teams. Other questions included, has anybody done any kind of study to see what the increased cost is going to be for gowns and gloves because of this? And how is it going to affect the psyche of our residents? The director of the nursing home division stated, "We're merely embedding the CDC's recommendations into the guidance. Inclusion of feeding tubes in CMS's guidance appeared to be a departure from the CDC standard, applying only to individuals identified as having certain MDROs. 100% of these residents would now apply to this measure, not just individuals within a unit." Others questioned how and when they should determine whether to use EVPs, noting these evaluations should be done on an ongoing basis, such as whenever a resident is admitted, out of the hospital, readmitted, a change in condition, a new wound changing their status as far as needing to use EVP, or change in indwelling catheter or other medical device that necessitates the need to evaluate to determine whether or not EVP would be appropriate. Others would want to know more about the possibility of reusing washable gowns for the same resident, used by the same staff member, as well as where to store gowns to be easily accessible to staff entering resident rooms. While regulations require EVPs for residents with organisms targeted by the CDC, new CMS regulations leave facilities to decide how they will approach residents with other epidemiologically important MDROs, such as MRSA or MRSA. One caller noted the CDC websites provided resources by CMS that give nursing home staff no real way to discern when to incorporate the use of additional PPE. Despite any lingering questions about regulations, which went into effect only about 10 days after being issued, noted providers should be in compliance immediately, as there is no grace period, since EVP has been out for quite some time from the CDC. New UV tech wipes out viruses but not people, new research shows. A new light-based sterilization system has shown promise for destroying airborne viruses without some of the issues of previous systems. Such tech could be extremely useful in LTC facilities, where there's a disproportionate threat of diseases like COVID or flu compromising residents' health. Far UV could be suited to protecting residents against COVID. UV sterilization technology isn't new, and most systems require a room to be empty, as the light can damage the resident's eyes and skin, like a tanning bed. This renders such methods less effective because an empty room could be sterilized only to become a virus-laden danger zone once people start repopulating the space. By utilizing far UVC light, occupied rooms could be sterilized without causing any harm to the residents, and they deactivated 99% of viruses in an occupied work environment. Whole room disinfection with far UVC is an emerging intervention for epidemic control, with the potential to become part of a layered strategic approach to minimize transmission of airborne pathogens in occupied indoor spaces, including ventilation and filtration. Several promising recent innovations have demonstrated the ability to neutralize diseases particularly dangerous to seniors. Certain laser-like wavelengths of light can destroy protein structures within COVID, a recent study demonstrated. In addition, a light sanitizing robot, Xenix Light Strike, received the FDA clearance late last year as a roving UV germ zapper. Next up, CMS provides the first look at a shorter, risk-based survey process. CMS last Wednesday revealed initial info about a potential risk-based survey option that could be available to some of the nation's best-performing nursing homes. A condensed survey process to compensate for backlogs and staffing shortages in the survey world. A more efficient survey process has long been requested by nursing homes, whose clinical leadership teams could be tied up for days during an on-site visit. CMS is working with states to test this process over the next several months and said the proposed risk-based survey approach would allow consistently higher quality facilities to receive more focused surveys while still ensuring compliance with health and safety standards. Higher quality could be indicated by a history of fewer citations for noncompliance, higher staffing, fewer hospitalizations, and other characteristics such as no citations related to resident harm or abuse, no pending investigations for residents at IJ for serious harm, compliance with staffing data submission requirements. The agency would limit the max number of participants, possibly at 10% of nursing homes in each state. The survey resources saved by performing a more focused review of the required areas of a standard survey in these higher quality facilities would then be available to perform more timely oversight of facilities where risks to health, resident health, and safety are greater. If concerns about resident safety were encountered, though, it would be immediately expanded. Resident safety will always be prioritized, regardless of the type of survey process. The shortened surveys would not be used for complaint surveys. The President's proposal for fiscal year 2025 budget includes an effort to move future survey spending from discretionary to mandatory, increasing funding to cover all statutorily mandated surveys, which are required annually. CMS asked for other increases recently, including a 40% request last year following the Senate investigation that drew widespread condemnation of post-COVID nursing home survey delays, and has been flatly denied and ignored by the Congress. Providers deserve fair and reasonable process, including more timely follow-up surveys that help head off extended denials of new admits, mounting penalties, and added stress and pressure that come with either. Given the brokenness of both survey funding and budget system, it appears unlikely that the Biden administration or CMS will get their wish for more cash next year. And that could make a successful risk-based survey process an important crutch in the coming months and years. By modifying some surveys based on compliance and quality history, the ability to devote more time and resources to nursing homes with lower quality, whose residents are at higher risk of harm, makes the process better. And up last, CMS clarifies updates for SNFs in fiscal year 2025 proposed rule. CMS addressed updates outlined in the proposed SNF prospective payment system rule for fiscal year 2025. Officials discussed the payment provisions, market, and basket updates, along with changes to the QRP and the new social determinants of health items. They also discussed the rationale behind expanded CMP guidelines. The proposed rule estimates an aggregate impact of increasing payment rates by approximately 4.1% or $1.3 billion. The increase is based on factors such as 2.8% proposed SNF market basket increases, forecast error corrections, and productivity adjustments, aiming to enhance the payment rate accuracy and appropriateness. Proposed modifications of the SNF QRP requiring SNFs to collect and submit SDOH items through the MDS, focusing on living situations, food, and utilities. Additionally, CMS is adopting a validation process for the MDS data, aligning with its goal of improving care and quality and addressing residents' social needs, beginning to collect items on admit beginning October 1st, 2025 for fiscal year 2027. CMS also proposed operational updates, such as adopting a measure for retention and removal of the policy to ensure the program focuses on quality metrics. The federal agency is also updating the case mix methodology for the total nurse staffing measure. Currently, the program includes 8 quality measures derived from various data sources and is a pay-for-performance program. Changes align with CMS's efforts to incentivize quality care in SNFs and includes updates to case mix or risk adjustment methodology, changes in exclusion criteria, and updates required to accommodate changes in content and availability of the assessment data. CMS officials also discussed revision to CMS's nursing home enforcement regulations. Proposed changes include allowing more flexible imposition of CMPs for noncompliance, allowing both per instance and per day CMPs. The aim of this change is to give CMS more flexibility in addressing noncompliance, posing risks to residents' health and safety. Changes also seek to provide more flexibility in addressing repeated instances of noncompliance and encouraging facilities to resolve deficiencies permanently, allowing for more consistency in penalties imposed across the nation and expanding current enforcement, allowing for additional CMPs more closely aligned with noncompliance. Thank you for joining News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.